My name is Callie Hunter. I'm the Skills Lab Coordinator at North Central Missouri College, and I will be demonstrating how to insert a Foley catheter today. So first thing that I want to do is check my physician's order to verify that I am to insert a Foley catheter. Also, I want to determine what type of catheter I'm putting in today, whether it be an indwelling catheter, a straight catheter, and the order did state that we're going to insert an indwelling catheter. So next thing that I want to do is gather my supplies. So I'm getting my catheter kit. This is a 16 French catheter kit, which is a pretty standard size. However, that size can be adjusted based on your patient. Next thing that I'm going to do is enter my patient's room. So knock knock. Hi, Mrs. Jones. My name is Callie Hunter. I'm going to be your nurse today. And your doctor has ordered us to put in a Foley catheter today, which is a small tube that's going to go up into your urethra, into your bladder to drain your urine. The reason he would like us to put that in is for your surgical procedure this afternoon. And hopefully once your surgical procedure is finished, we can remove the Foley catheter. This shouldn't cause you a lot of pain, but it may be a little bit uncomfortable for you. Do you have any questions at this time? The next thing I need to do real quick is just have you state your name and date of birth. And she does state her name, and her date of birth is appropriate with her wristband. So next thing I'm going to do, Jane, just real quick, is wash my hands. So I'm going to come around and wash my hands here. Okay, so I'm going to wash. I'm going to provide privacy. I'm going to ask any other individuals in the room to go ahead and step out. Jane, can you tell me real quick, do you have any allergies to anything, betadine, latex? And she says no at this point. So I'm going to go ahead and position you, Jane. I'm going to raise the head, or raise your butt up so it's more comfortable, at a more comfortable height. I'm going to go ahead and position you in a diamond-shaped draped position. Okay, I'm going to go ahead and get me some warm soapy water so that I can do perineal care prior to the procedure. So I'm going to apply gloves. I'm going to take my warm soapy water. I'm going to go ahead and perform perineal care at this point in time, cleaning her. I'm going to dispose of that equipment in the water. I'm going to remove my gloves and rewash my hands. So now at this point I'm ready to come around and insert my Foley catheter. I am right-handed, so I want to be sure that I'm on the appropriate side of the bed to insert the Foley catheter. So I am going to have to leave her exposed at this point in time. Of course, I would have the drapes pulled just because once I am sterile, I'm not going to be able to touch that blanket. Next thing I want to do is just inspect my catheter kit to ensure that it's not wet, it's not contaminated, so that I'm not breaking my sterile field. I'm also making sure that my table is about waist level or so. So I'm going to go ahead and open my catheter kit. Just going to set this to the side. Okay, and I'm just going to turn this so that I can see both of my areas here. I'm going to open. The first turn is going to be away from me. The second is going to be to the side, with the last turn being towards myself. And again, that's so that I don't reach across to my sterile field. I want to be sure this corner kind of points towards me, so we do have a 1-inch unsterile border that we are able to touch. So I'm just going to grasp that and turn it, okay, so that I don't risk leaning up against it. Next thing that I'm going to do is place the sterile drape underneath her bottom. So I'm just going to grab the corners of her drape here. I'm going to ask Mrs. Jones to raise her bottom, and I'm going to put the shiny side or the slicky side down right underneath her bottom, and I'm just going to slide that under. Okay, once I've done that, next I'm ready to go ahead and apply my sterile gloves. So I'm going to pinch them as I pick them up, and that's to ensure that I do not touch the other things inside my sterile field. The outside of this package is unsterile, so I can touch it. I want to ensure that I don't open up my unsterile package on top of my sterile field. So I'm going to come down to the end here where I can still see my sterile field here and open my sterile gloves. Okay, as you can see, once you open these gloves, they do kind of come in a wad, so you want to be sure to be careful as you're applying your sterile gloves. So I'm going to don my dominant hand first, or my right hand. So I'm going to pinch the cuff of that glove. I'm going to slide my hand in, being very careful not to touch the outer part of the sterile gloves. Once I've got those on, I'm going to take these fingers and go underneath the cuff of the other side. And again, I can touch this 1-inch unsterile border here. Okay, and then I'm just going to slide my hand in. And now I have got my sterile gloves on. So at this point, I'm going to go ahead and come back around here and set up my sterile field. This next drape is optional. I prefer not to use it just because it more gets in my way than anything, so I'm just going to drop it to the side. Next, I'm going to separate my 2 containers. Okay, I'm going to go ahead and pour my betadine solution over my cotton swabs. Okay, then again, I'm dropping this to the side, using my princess fingers is what I call it, to ensure that I'm not going to touch any of the unsterile field. I'm going to go ahead and test my balloon. Evidence-based practice does say that there are some manufacturers at this point that recommend not testing the balloon. So you are going to have to be aware of that. If it is a manufacturer that does not encourage that, then of course you wouldn't test the balloon at that point. I am testing the balloon to ensure that it's not going to burst and it can withstand all of the fluid that is going to go in there. This is a 10 cc syringe, okay, of sterile water is what you're inserting into the bulb. Next thing that I'm going to do is go ahead and do my lubrication. So I'm just going to pop the cap off. I'm going to take the plunger out. I'm going to go ahead and remove this blue package. Okay, now it's very important as you remove this blue package that you're very careful, because this tube that's going to go into the urethra is very flimsy, okay, and can touch the unsterile field. So I'm going to go ahead at this point and put my 2 kits back together. Okay, and now I'm ready to move in between my patient's legs. So as I pick this field up, I want to be sure that I'm not getting against that 1-inch unsterile border. So I'm going to pick this up and I'm going to move over in between my patient's legs. Okay, so at this point I'm going to separate my 2 containers. Okay, I'm going to tell Jane here that she's going to feel me touch. Okay, that this may feel a little bit cold to her, so I'm going to spread the labia. Okay, once this hand is here, this hand is committed. Okay, you're not going to be letting go with this hand, even though it may feel it's going numb. Okay, but you need to keep a hold there. So next thing you want to do is clean your patient. Okay, you're going to clean the side and drop, the opposite side and drop. Okay, down the center and drop. And I do go ahead and use all of my cotton swabs just to get her good and clean. Okay. Next, I want to go ahead and just drop these at this point. That way I don't take anything contaminated back into my sterile field. I'm going to go ahead and move my box just a little bit closer. I'm going to go ahead and coil this tubing up into my hand, and that's just to ensure that it's staying in my sterile glove and I'm not going to contaminate or touch anything. You want to be sure to hold close enough to the tip. That way you don't hold back too far where it's flimsy. Okay. So next I'm going to tell Jane to take a deep breath and kind of bear down. That will kind of help open the urinary meatus. Okay, as I do that, I'm going to insert the tubing nice and slow, being sure that as I insert it that I'm not hitting it against her leg or against my fingers as I'm inserting that. Once you see urine return, you can go a couple inches farther. However, I encourage you to go clear to the Y. That's just to ensure that we are not going to inflate the bulb inside the urethra. That can cause some major trauma. Okay, so I'm just going clear to the Y. I'm going to go ahead at this point and bring my 2 fingers around to hold that. I'm going to inflate my bulb. At this point we should have urine return. Okay, you're not going to inflate the bulb if you do not have urine return. So I'm going to go ahead and inflate the balloon at this point. Okay, now I can let go here and I'm going to pop that off. I want to pull back, okay, till I can feel resistance. Okay, and that's just to ensure that that bulb is at the base of the bladder. I'm going to secure this to my patient's leg. You could use tape or a leg bag or a leg wrap. Okay, I'm going to secure this to the bed frame. Okay, not the bed railing. Okay, to a stationary part of the bed. So I'm going to secure that there. Next thing I'm going to do is just clean up my area here. Your patient will also have all kinds of betadine and lubricant and things on. So once I've done that, I'm going to remove these gloves. I'm going to wash my hands and apply new gloves. And then I'm going to provide perineal care and catheter care to ensure that I get her good and clean. I'm going to reposition her so that she is comfortable. I'm going to go ahead and lower the bed back down. I'm going to raise the side rails, give her call light, and be sure that she's comfortable. And that will conclude fully catheter insertion.